Okay, yes. So, as I was saying, thank you so much, Dr. Emini, and thank you so much, Dr. Sama, for coming forward and practicing. I do agree that these are two really challenging scenarios, and to practice them in front of an audience, it's quite courageous of both of you. Thank you very much. Now, so today we are going to take a look at two scenarios. Okay, so we are going to discuss scenarios today. I have written anuresis here, but I took it out the last moment. Anyway, so we have refusal of tonsillectomy, night terrors, discussion of both of them, and question and answer session. So if you have any questions, please drop them on the chat box. I will answer them after the discussion is over. Okay. First, let's start with the first scenario. So you are a junior doctor in the GP practice. Daisy is the mother of 7-year-old Luke, who was diagnosed with recurrent tonsillitis. Daisy has called the clinic because she has some concerns regarding her son's referral to the ENT for a surgery that was rejected. The child has had 5 episodes of infections over the past 6 months. The mother had made the request for referral to ENT for the surgery. Please talk to this mother and address her concerns. So, as all of you might guess already, if you have not, please know that this is an ethics scenario. Now, dealing with ethics scenarios is a little bit different from the normal counseling stations that we have. How do you know this is an ethics scenario? Because this talks about a child who was rejected for a procedure. So you know that this is an ethics scenario. That's the clue, and you have quite a lot of information which is given here in the question. You have already been given the information that the child has been diagnosed with recurrent tonsillitis and that he was referred to the ENT for a surgery and that was rejected. And now this mother is calling you because she wants to know why did this happen. Okay, so what do you do in such scenarios? How do you proceed? Let's talk about that. Okay, so first thing, if you want to know more about this, I'm going to tell you the things in brief details, but if you want to read more, if you want to keep yourself informed more, I will drop in some links and some references at the end of the meeting, and you can go and take a look at that. So now we have this whole document on the GMC-uk website that is called shared consent. If you click on shared consent on the GMC-uk website's ethical guidance section, you will find another subcategory which says consent, patients and doctors making decisions together. So this is what you are being tested for. So you are being tested for the components of this document. Okay, this scenario deals with basically consent and making a decision together. So what does the document tell you about? In a brief aspect, I will tell you that it talks about 4 things. That is, you need to inform risks about the procedure to the patient or the relative, whoever has called. Second thing, if they refuse to hear the information that you want to discuss, how do you handle those situations? I'm going to talk about that in the coming slides. Okay. The other thing is written consent. You need to explain this, and lastly, you have to record this meeting. So how do you record this meeting? Either you note it down, you talk about documentation, okay, or you actually record it. Okay, so these are the 2 ways in which you can record this conversation which is going on. So these are the 4 components of the shared consent document which is available on the GMC UK website. You are being tested for these 4 components, and you need to know what to do, and you need to demonstrate that I have incorporated these 4 components into my scenario. So how do you do that? Okay, how do you do that? Let's go ahead and discuss how do we do that. Now, I do have some pointers here which will tell you how do you do that, but I will show you the scenario, what to do in the history taking, what to do in the management after this slide. Okay, so these are some points which I have summarized from that document. What it says is you begin your scenario by listening to all the concerns or the anger that the mother has. That's the first thing that you do. You respect her view, so you need to tell her that you have a valid concern. I can see that you're quite upset regarding the letter. Acknowledgement of non-verbal cues. Even on the telephone you can get non-verbal cues. You are supposed to pick it up. Okay, So that's what it means when they say respect the views. So whether you have a face to face consultation or whether it's on a telephone, please acknowledge the emotion behind that. Okay. Next, moving on, discuss treatment and care. So what this means is you need to assess knowledge, share information. That is, what does share information stand for? Would you like me to discuss about this to you? You have to ask permission before you start sharing any information regarding the topic. Over here, your topic is surgery for recurrent tonsillitis. Maximizing patient opportunities. What does maximizing patient opportunity means? Offering an appointment with a senior team member to discuss this further with the line manager of the surgery who has rejected the request for surgery. So you have to give her appointments with various people at various levels so that her concern is addressed better. That's what it means when we say maximize patient opportunities. In this, you can also include advocacy services, complaint writing services, and all those things. Okay. Clinical audits, all that comes under maximizing patient opportunities. Next, respect their decisions. If she says, I am not happy that my son's surgery request has been denied, so you have to respect that. Okay, how do you demonstrate that? I will talk about it. Okay, the other thing is there is no single approach. That is, you cannot go in and expect that if I'm going to do this, the simulator is going to be very happy with me, or this mother or this patient themselves they are going to be very happy with me and they are going to cooperate with me. Please do not expect that. It does not happen. Okay. Customize your management. This is what the document itself says, this, that you need to customize your management. Why? Because these things are there in the document itself, firstly. Secondly, there are aspects here. If you do not address these things, if you do not talk, acknowledge their non-verbal cues, if you do not ask permission to share information or to discuss information, then they might be very rude to you, and if you straight away jump to the management, it will not look nice on you. So that's the reason why you need to customize your management. When you enter, she might be very angry, she might scream at you. When the person after you enters, she might be very calm and peaceful, and she might be very cooperative. So it depends. You should know how to navigate in the scenario. And how do you navigate in the scenario is if you have a background knowledge of what you are doing inside in this cubicle, what are you being tested for, what are the components you need to demonstrate, you would perfectly know how to customize your management. This is what they mean when they say that. Okay, moving on. In the history, what do you do in the history part? Like I said, first thing you do is you confirm the identity. So if you see this purple icon that I have put here, that's what I mean. It's a telephone conversation. Please do confirm identity, relationship with the patient. Now, you allow the mother to speak. So she will tell you everything what you need to know. She will say that I'm really angry. My child has had 5 episodes of tonsillitis, and before this, he has had many episodes, and I don't understand why the surgery has been rejected. Is it because you want to save yourself some money? Is that why my son's surgery has been rejected? This is what she will say. So what do you do in that scenario? You let her speak. Once she's done speaking and you hear a pause, that's when you will start talking. So you will say, Daisy, I can really hear the amount of feelings you have expressed while speaking to me. I can realize that you're quite upset because your son's request for surgery has been rejected. I do want to speak to you regarding this, but before that, is there any other concern regarding the request being rejected or regarding Luke that you would like me to know or you would like to talk about? Okay, so please ask any other concerns. If she says, no, doctor, I just want to know why my son's request for surgery was denied, then you move on to assessing knowledge. So, Daisy, could you tell me what do you know about tonsillitis and what do you know about the surgery which is done for this condition? So you assess knowledge, you ask her to speak, you encourage her to talk. So that's when she will tell you that I know it means sore throat. So my son has sore throat and he has a fever. Sometimes he has lumps in his neck. he doesn't have a cough along with that. I have been to the GP a numerous number of times for the same complaint to know what is tonsillitis. And I also know that the surgery that is done for this condition is where you remove the tonsils of the child, and that's the surgery I was asking for. So when she has demonstrated that she knows what's going on, then that's when your next question comes. Right. So, do you know or have you been informed of any of the risks that are going to happen with this surgery? So, you ask about the risks. Even though I have written here details of the conditions, ideas, and expectations, like I said, after you have assessed her knowledge, please ask her about the risks. Okay. So, you are asking if she knows what's going to happen with the surgery. Okay. That is what comes under your data gathering. Now, moving on, allow her to speak, encourage her to talk. She should tell you these answers, because I'm pretty sure she has answers to these questions. Okay, after you have asked her about the risks and she says yes I know or no I don't know, depending on that you will move forward. If she says yes I know, then please ask her, okay, so could you please tell me what are some risks involved in this? If she says no doctor I don't remember, then you have to tell her with every surgery there's a risk. But before I discuss that, I would like to ask you, what are your thoughts regarding this rejection? Okay, so you're asking her the ideas. What are your thoughts regarding this rejection? You want to know from her mouth, why does she think this has been rejected? Please do not offer her a platter of ideas. Okay, please don't do that. Please don't go ahead and give her a platter saying, you know, your son's request is rejected because he's 6 years old, because the surgeon didn't want to do it, because you haven't documented. Please refrain from presenting your platter of ideas. Instead, encourage the patient to say, why do you think this has been rejected? So she will say it once again. She'll say it's because you guys do not want to operate on my son because of the cost. Okay, I'm really sorry to hear about that, Daisy. You have to acknowledge that once again. I'm really sorry that you feel this way. However, I will come back to this, but what are your expectations from this conversation? Doctor, I just want to know why my son's request for surgery was denied. This is what she will repeat once again. Now, here comes the most interesting part. Okay, this is what is mentioned in the ethical guidance in the gmc-uk website. What they say is that paragraph 54, please do check on the shared consent document. Paragraph 54 says, involve the child even if they cannot make their own decisions, which means that you need to examine this child, you need to assess their mental capacity and decision making, you need to ask this child if it is in their best interest. And also please note that the child is 6 years old. Even if he's 6 years old, he understands what is his problem, what will be done for his problem. Okay, he can refuse. Even if he doesn't understand, he can refuse. Okay, so this is the right which is given to the child. And that's why over here, you need to call this mother with the child to the GP clinic so you can speak to the child. And you have to tell the mother this in the management. This is what you're being tested for. You're not being tested for criteria of tonsillectomy, more than 5 episodes, more than 7 episodes. Every single person on the day of the exam is going to go and say the same thing again and again, again and again. And then 3 people, she might say, okay, okay, okay. Then the fourth person who tells her about the criteria, she might start shouting at them. So please do not be that person who is going to have a difficult time. Okay, instead of that, just tell the mother over the telephone. What about Luke? So can you tell me, is Luke aware of his condition? What does he think about the treatment for this condition? Is he aware that he needs to undergo a surgery? What are his thoughts about it? So if she says, I don't know, doctor, he's a kid, why are you asking me this? So then you can tell her, please, okay, all right, I will come back to this also, but let's move on. So Daisy, would you like to know more information regarding the treatment? What I'm asking here is, I'm asking her, would you like to know the criteria? So she will say, no, I don't want to know, doctor. I just want to know why my son's surgery was not dine. Okay, so start explaining options of treatment. So, like you said, Daisy, you are a brilliant mother. You are already aware of the forms or options of treatment available for this condition. Like you just told me, steam inhalation, paracetamol, antibiotics. This is the treatment for the condition. Apart from that, of course, there is surgery. Would you like to know the risks and benefits? If she says yes, please tell her. If she says no, then move on. And that's when you can tell her that, okay, Daisy, moving forward, our plan is I would like you to take up an appointment, come to the clinic with Luke so that we can examine him and we can explain to him about his condition and what is the treatment. We can ask him if he thinks this is a treatment he would like to opt for. This is very important because this is what the good medical practice asks us to do. A child can make decisions or be aware of the decisions which are being taken for his health, and they also have a right to refuse. So that's why we want you to come to the clinic. So please do come with the child to the clinic. What else I would like you to do is I would like you to speak to my senior team member. They may be more experienced in this and they may be able to tell you in a much better way why your request for surgery was rejected. Apart from that, what you can do is you can take a second opinion from another doctor and see if this was the right decision and the decision that you think that your son should get a surgery for tonsillectomy is valid or not. So you can seek a second opinion. This is what I'm trying to say. I will give you some written information about this meeting. I will also post you some leaflets so you can take a look at the condition and the forms of treatment available. Summarize. So, Daisy, do you have any concerns? Would you like me to repeat anything that I have said? But right now, what I can do for you is I can arrange for you an opportunity to speak to a senior team member. I can also arrange for you an opportunity to get a second opinion. Please do come back with Luke for an appointment so we can examine him, we can have a chat with him and discuss what are his thoughts about the condition and its treatment. In the meantime, please do read up the information that is being sent to you. This will help you to decide about Luke's treatment in a much better way. Thank you. Finished. That's all. That is it, what you are going to tell her. This is what she wants to know. This is what you have to do. This is not me who is saying this. If you go do a nice Google search on gmc-uk ethical website, this is what you will find, and these are the points that you need to talk about. Okay, so please remember, the moment you mention criteria, she might start screaming and shouting at you. So at that time, what you do is you already ask her permission. Would you like to know more information regarding the treatment, options of treatment, risks of the surgery? If she says yes, explain. If she says no, move on to this part. Okay, we do not know why this child's tonsillectomy was refused. Do you have any information in the question? If you look at the question, see, it does not give you any information why this was rejected. So over there, if you go and sit down and offer a platter of reasons why the request for surgery was denied, you might be losing scores, not gaining them. Okay, this is about this scenario. If you have any questions, please leave them on the chat box. I will answer them after I discuss the second scenario. Okay, moving on. Second scenario. You are a junior doctor in the GP practice. Mary is the mother of 6-year-old Isabel. So Mary has called the clinic because she would like to discuss Isabel's trouble in sleeping. Please talk to this mother and address her concerns. So this is your second scenario, okay? When you start, yes, you start with the, once again, introduction, confirmation of identity, confirmation of details. Is this a good time to talk? Yes, this is. Okay, all right. So what makes you call us today, Mary? So she says, I have a concern because my daughter, I've noticed that she wakes up in the middle of the night, screaming, shouting, and kicking. Okay. How long has this been going on? It's been going on for 2 weeks, doctor. So the rest of the history was fine. So how many times have you noticed it in the week? So she says 3 to 4 times, and it's just one episode in the night. In the morning, when I ask the child, the child doesn't remember that this event has happened. What do you want to ask after this is some important questions. So you move on to your differentials, okay, right then and there. Has the child hurt themselves because of this episode? Have you noticed them screaming or shouting? Have they hurt anyone else in this process? Okay. And the other thing you need to ask is behavior concerns. What I mean by saying that is, are there any concerns from the, do you have any concerns regarding the concentration? Does Isabel go to school? Yes, she does, doctor. Are there any concerns from the teachers regarding her behavior at school? She says, no, doctor, nothing like that. She seems to be fine. So these are some important questions to ask over here. Okay. Why? Because you want to do your differentials right away. What are your differentials over here? What do I mean when I say any injury to the child and behavior concerns is I'm trying to rule out parasomnias and absent seizures. This is what I'm trying to rule out over here. Okay. So when this mother is saying no, she has not injured herself, she has not done anything that could hurt her or anybody else, right? And her behavior is fine. So I'm quite satisfied that this is a night terror. If the mother says, yes, there are some concerns regarding her behavior by the teachers, they have informed me that they need to call her a few times to get her attention. That means you are dealing with something which is a red flag, and this child needs to review in the clinic immediately. Okay, so that's why we ask differentials here, and that's the reason why you need to know what are you looking for in this scenario. So your two differentials here are absent seizures and parasomnias. Okay, if these two are not there, then you can safely go ahead and diagnose night terrors. What else is important? Is this the first time? Yes, it's the first time. So, any other medical conditions the child has? No, she doesn't. Okay, how about during the birth of the child? Was there any trauma or was there any injury experienced by you or the child? No, doctor, it was not. Are you up to date with the jabs? Yes, I am. Does the health visitor have any similar concerns regarding the child? No, they don't. How has been the development of your child? Oh, it has been fine, doctor. What about the diet, wee and poo habits? Yes, it has been fine, doctor. When I say wee and poo habits, I also mean sleep hygiene. Please do ask about that. Okay, now moving on. Very, very important to ask family history of similar complaints in the father or the mother. If you simply say family history, she will say, oh, I don't mean know what you mean, grandmother, grandfather, this, that. Please do not confuse all those things. Ask specific, direct questions to get specific answers. Any history of similar complaints in you or the father of the child? No, doctor. Okay, so can you please tell me something about your family? So, who are the carers involved? Are there any siblings? Oh, no, doctor, she's just our only child. It's me and my husband who live. Right. So does Isabel have a separate room? Does she sleep by herself? So that's where the mother will tell you that no, doctor, she sleeps with us. Okay. So here's where you pick up something that you need to counsel this parent about. Now I will tell you why these questions are important as opposed to the very long questions that you may have with you already. This is a focused history that I'm talking about over here. These are the things which are very important. When I start talking about night terrors, you will know why this is important. Okay, now moving on. So over here, you asked about the red flags, and this mother said that there is nothing which concerns her except the fact that the child wakes up in the night, starts screaming, shouting, kicking, and then goes back to sleep. So you tell the mother that, well, Mary, when I asked you a few questions, it seems that your daughter Isabel has a condition called night terrors. Are you aware of this? Or have you heard this before? No, doctor, I have not. What is this? Right. So, night terrors is basically when the child wakes up in the middle of the night with a behavior which you have mentioned, screaming or shouting, hitting themselves or kicking. And when you ask them about the event in the morning, they do not recall this event. So that is what is night terrors. Please give reassurance along with explaining the condition. So basically, there is no definitive treatment for this. However, it resolves with time and without any treatment. Now, what we would like you to do is please keep a diary. Okay, so what do you do in the diary? Please note down the time and the days of the week when this happens, and also try to find out if there is any trigger which enables this episode to happen in the night. Now, it is very important that you maintain a good sleep hygiene habit before Isabel goes to sleep. Would you like some more information about this? Yes, doctor. So please make sure that Isabel is sleeping in a separate room with good ventilation and good lighting. Please make sure that she goes to the loo before bedtime and doesn't eat or drink anything heavy or doesn't drink a lot of fluids before bedtime. Okay. Please make sure that her device viewing hours are just 2 hours in a day. And before sleeping, you or the husband or the father of the child can try to read her some books and put her to sleep. Okay. So, this is some advice you can give her. And then tell her that we will give you some leaflets so you can read about this. Like I said, this does not require any treatment, it resolves with time. However, if you notice that the episodes are becoming more frequent, very good point, or if you notice that the child has hurt themselves in sleep, or you notice any behavior concerns, please do call us and come back for an appointment. So these are your red flags in this scenario. You are trying to give red flags for absence, seizures, and parasomnias once again. And okay, what is, as soon as I'll just tell you a little bit of more information. If there is a behavior concern or there is a history of parasomnias which is evident in the child, then you have to call the child immediately to the clinic and do a video EEG. Okay, so this is the treatment if there is something serious going on. But if there's nothing serious going on, please make sure that you use these short sentences when you explain about the condition, that there is no definitive treatment, resolves with time, doesn't, and it resolves without any treatment. This is your reassurance over here. Very, very important to reassure this parent. If you do not say these three lines, you will lose a lot of scores, which means that you haven't given enough reassurance to this parent, and this parent is constantly worried because they think something serious is going on with their child. So that's the reason why I say that please do give reassurance to this child. Okay, so this is your management over here. And I already told you about the focused history part. Now let me take a look at the questions on the group. Okay, before that, I also want to make a small announcement. There is one of a candidate who was on our group. Her name is Dr. Uttara. She has passed her exam. So congratulations to Dr. Uttara for passing her exams. She messaged me today. She told me about her result. I'm very, very happy for her. Yes, I'm very happy for her. Yes, all right. So this is the good news that I wanted to give you. Then let me see. Any questions which I have? Okay, I'm just taking a look at the questions. Right. Should we not ask how many episodes to check why she is rejected? If you do have time, see, there is no harm in asking this question. You can ask this question. Okay, if you do have time, please ask. But please also know that there are more important things to do over here. Okay. So your management needs to be perfect. If you ask these questions, it's completely okay, but it will just end up wasting your time. So be very sure of what kind of questions you are asking. Okay. Okay. So for those of you who have just joined the group for the first time today, let me just tell you, you can subscribe to my YouTube channel. I regularly put the session recordings on in there. So if you want, you can share it with your friends. If you would like to listen to the management that I have given for the refusal of tonsillectomy, you can even do that. So I'll put up the video by tonight, hopefully. And yes, I will let you all know once the video is up, but please do subscribe to my channel. I also have a Facebook page. I will inform on my Facebook page once that's done. So please do like my Facebook page as well. And if you would like to, please make me a contribution. The link is on the YouTube channel in the description box. If you'd like to, please do that. It really, really helps me a lot. Right. Any more questions that you want to ask and I should answer? Please let me know. Right. Okay. I don't think I have any questions. So you're welcome. I will see you on Saturday for the next session. Most probably, we should have a practice session, right? I'll inform about the topics and take care, everybody. Thank you for taking your time out and attending the session. I hope that the session has been useful and I have explained what you need to know. Okay, thank you so much. Take care. Have a good evening. I'll see you on Saturday.